inaasam. Kasipagan ng sagot sa lahat ka man sa kayamanan. Buksan ng pahina ng mga aklat ng karunungan. Edukasyon ating kailangan, kamamangan ating iwanan. Peace!
Ating lilipalin, ating papamilin,
ating tanawin,
bagong pag-asa ay muling tatanawin.
kinabukasan pagtibayin, pilitin mong gawin.
Pusang pagsisika,
Pag-asa ay yakapin, edukasyon ang kayamanan ng kahit ninuman. Isang pangarap ang tutupad, pagsisikapan ng lahat.
pusang pagsisika,
Kaya mo yun, kaibigan.
mabubuo isang pangarap.
Napansin mo ba na ang mga dati mong ginagamit na antimicrobial drugs tulad ng antibiotiko ay di na kasing bisa o di na halos gumagana kapag may sakit ang mga alagang hayop? Ito ay maaaring epekto ng isang lumalalang problemang tinatawag na Antimicrobial Resistance o AMR. Ang antimicrobial drugs ay may mahalagang papel upang puksain o pigilan ang pagdami ng mga mikrobyo at sakit sa tao, hayop o halaman. Ngunit, ang hindi bastang paggamit nito ay maaaring magresulta kalaunan sa antimicrobial resistance. Ilan sa mga nakagawian natin ay nakakadagdag sa problema ng AMR. Hindi tamang pagtapos ng gamot ayon sa payo ng veterinaryo. Ang labis na paggamit ng antimicrobials o antibiotic na walang reseta o payo ng veterinaryo. Maaari itong magdulot ng AMR hindi lang sa mga hayop, kung hindi pati na rin sa mga tao. Itinatayang 700,000 na tao ang namamatay taon-taon dahil sa AMR. Kung hindi ito maaagapan, maaaring tumaas ito sa 10 milyong biktima sa taong 2050. Halos 5 milyong sa tinatayang biktima ay magmumula sa Asya. Dahil sa pagtatayang ito, ang iba't ibang sangay ng gobyerno sa Pilipinas na nangangasiwa sa kalusugan ng tao, hayop, halaman at kapaligiran ay nagkakaisa sa pagpapatupad ng isang National Action Plan upang gabayan ng lahat sa tamang paggamit ng antibiotics. Gayunpaman, lahat tayo ay may kanya-kanyang tungkulin upang isulong ang tama at responsabling paggamit ng antimicrobials tulad ng pagreseta ng tamang gamot matapos suriin ng veterinaryo ang hayop, responsabling paggamit ng antimicrobials ayon sa payo ng veterinaryo, at pagtupad ng good animal husbandry practices sa pag-aalaga ng hayop. Marami pang ibang paraan upang mapigilan ang paglaganap ng AMR. Lahat tayo ay may magagawa na makatutulong para pigilan ang paglala ng AMR. Makiisa sa National Action Plan at sama-sama nating labanan ang AMR. Sama-sama nating ideklara, I am responsible.
I am responsible. Mr. Ratos Radro.
Good Monday afternoon to all our live viewers in all platforms of DepEd from Luzon, Visayas, and Mindanao. And welcome to the first part of our webinar series on integrating antimicrobial resistance concepts and awareness in basic education classrooms. Good afternoon as well to our Zoom platform viewers, our senior high school regional and division supervisors, and our science regional and division supervisors as well. Joining us in this Zoom platform are our supervisors who are also and we are also being currently watched by our teachers all over the country via DepEd Philippines Facebook page, DepEd Tayo, and DepEd YouTube channel. So here are some of the webinar topics flashed in your screens. And for this afternoon, we will be focusing on the basics of AMR and how they can be taught to our younger learners. Tomorrow, we will be focusing on the secondary, but for this afternoon, we will be specifically targeting the teaching of AMR concepts and awareness to our elementary learners or to our younger learners. This is so that our teachers can effectively and seamlessly integrate its concepts in the classroom discussions and assessments. We are so grateful to our field offices who participated to our contest and disseminated the webinar information to their respective teachers and the link to the Facebook Live to their teachers. Good day to our Zoom participants and to our almost 500 Facebook Live viewers. Please continue to react on and share this webinar. Here with you this afternoon is Wani Milaine N. Santos, Senior Education Program Specialist of the Bureau of Learning Delivery, Teaching and Learning Division. As said by Gro Harlem Brundtland, if the world fails to mount a more serious effort to fight infectious diseases, antimicrobial resistance will increasingly threaten to send us back to a world where there is no antibiotics, or to the world back to a pre-antibiotic age. Hence, this afternoon, our two competent resource speakers will capacitate our teachers on how to integrate this very important concept in their lessons. But before we proceed to our topic, let's have some energizer or some check-in activity. It's a very simple activity. This one is called Fill Me In. We will be showing you letter clues and you have to guess the full word or phrase. We will be giving you 30 seconds to look at the letter clues and type in your answers. I am inviting all our viewers to participate in the activity by simply sharing the comment section of the live feed, and to our Zoom participants, to our supervisors, you may type in your answers as well in the Zoom chat box. Are you ready? Yes, our participants from our Facebook Live is already ready, or they are already excited to answer our energizer for today. I'm so happy that you are, and now let's start. This is our first word or phrase. What do you think is it? Okay, so I think we already have some answers from our Facebook Live page. Let's see if you got this one correctly. Oh, I think someone raised her hand. Mami Resol, good afternoon.
Good afternoon.
Good afternoon, Mami Resol. What do you think is the answer?
Antibiotics, am I right?
Very good. Yes, ma'am. You are correct po. You are right. The answer is antibiotics. Same thing with our viewers from Facebook. They also got the correct answer. Congratulations. And if you didn't get this one, please try again in the next letter clues. Now let's proceed to the second letter clues. Please comment down your answers if you know the answer or if you have a clue on what the answer would be. Let's see this time who got the correct answer. What do you think is the answer? How about our Zoom platform participants? Is there anyone who has an idea what the answer is? Nako, mukhang sa Facebook, wala din. Medyo mahirap po siguro ito, no? Pero let's see. Let's wait a little more. Baka meron po sa kanila ang nakakaalam. Sirit na? Aha. This one is a little bit difficult. So, let's see. The answer is superbugs. So, superbugs are strains of bacteria, viruses, parasites, and other pathogens that are resistant to antibiotics. That's the answer, superbugs. Okay, so that was quite difficult, but I'm sure that some of you already have an idea on what it is. Yan. I think si Sir Prince Miko of our Facebook Live viewer, nakuha niya po yung sagot. Also, Ma'am Verly Reyes and Ma'am Dina Jimenez and Ma'am Cherry Pie Cabajes Bituwa also got the correct answer. It's superbugs. Congratulations po to those who got the right answer. I know that was quite difficult, but I'm sure the next one and the last letter clues, you will already get this one. So let's see. This is the last letter clues for this activity. What do you think is the answer? Ma'am Mirasol is raising her hand, but let's see, baka meron pa pong iba bukod kay Ma'am Mirasol sa ating mga supervisors na nandito po sa Zoom. Please don't hesitate to raise your hand. Yan, si Ma'am or Sir Jansel.
Evolution.
Yes po, Sir Jansel. Congratulations, that is correct. The answer po is evolution. Thank you very much po for answering, Sir Jansel. And also our Facebook Live viewers, hindi rin po sila magpapatalo dahil nakuha rin po nila ang sagot. You are correct po, Ma'am Aida Santos Unabia, Ma'am Shayak Mango, and also Sir Anthony Alvarez Novillos II. You are correct po, the answer is evolution. Evolution is basically one of the main concepts of antimicrobial resistance, as microbes develop evolutionary mechanisms to protect them from antibiotics. I am so glad that most of our participants, both in the Zoom platform and in our Facebook Live, have a prior knowledge on antimicrobial resistance. Now let us dig deeper on how the complex concepts of AMR can be integrated in the classroom, both in discussions and assessments, particularly for our younger learners or our elementary learners. Before I pass the floor to our first competent resource speaker, we remind our participants that they may type in their questions or queries in the comment section as we go along in our discussion, and we will be answering them during our Q&A session. So again, both our Zoom participants and Facebook Live viewers, you may type in your questions as we go along the discussion. Without further ado, it is my honor to introduce our first speaker who will tackle the basics of antimicrobial resistance. And ladies and gentlemen, we have this afternoon Dr. Regina P. Berba, Chair of the National Antimicrobial Stewardship Steering Committee of the Department of Health. Good afternoon, Dr. Berba.
Good afternoon po. So good afternoon, everybody. We're waiting for the slides to appear. I'm really very excited to be here with you this afternoon. Ako po ay isang guro din. Nagtuturo po ako sa College of Medicine at the UP Manila sa Philippine General Hospital. So, let me start off. So, gusto ko po introduce sa inyo na meron tayo naging big celebration 2 weeks ago actually, World Antimicrobial Awareness Week. And this is something that happens every year between November 18 to 24. Yun na po talaga yung na-mark sa calendar natin. And for this year, in 2021, the theme is hashtag spread awareness, stop resistance. Yun po yung reason why we are trying to spread awareness to more stakeholders. And we are really, really very happy that you, the teachers, are with us this year and hopefully sa coming years, and will be the bridge for our youth. No? So in Filipino, it's hashtag kaalaman ay dagdagan, AMR sa gitna ng pandemya ay labanan. So let me congratulate you all for taking part in this very important DepEd activity. Parang ano to phenomenal na this many advocates or soon to be advocates will be joining the fight against AMR. No? So ano muna yung AMR? What is antimicrobial resistance? Yan. So usually associate natin siya sa certain antibiotics, but not only antibiotics but also antifungal, antiviral, antiparasitic. Lahat po yung nagfo-fall under what we call antimicrobial agents. So ibig sabihin, when there is AMR, the bugs or the microorganisms which cause infection are not killed anymore even if you give these medicines. So they have been able to develop resistance or mechanisms that fight off the effect of these important medications. So in turn, they do not respond anymore to the medicines, making infections very difficult to treat. Bilang doktor nga po, minsan talaga nagkakaroon kami ng mga pasyente na hindi na talaga gumagaling. So they succumb to death because there are no more medicines to treat them. So you can think of it na yung sinabi kanina ni Ma'am Elaine, evolution, di ba? Nangyayari kasi it's part of the natural history of bugs. Kaya nagiging super bugs sila. You can picture them as really all of these little microorganisms, pero nagkakaroon sila ng additional strength to fight off what is supposed to slow them down or kill them. Okay. So yung purpose po nung first part ng lecture ko, this one, the basics, is for you teachers to just have a better grasp of what AMR is. Hindi ko naman ini-expect na ito rin yung ile-lecture nyo sa mga students, pero I think it's very important na parang medyo firm at very confident tayo sa ating sasabihin sa ating mga estudyante. So but you can certainly use a lot of the illustrations, infographics, mga covers, yan. Kasi all of them really try to express yung ating fear nitong phenomena na to. So, antibiotics seen as miracle drugs are now losing power. Kaya super bugs no? In the hospital, we call them multi-drug resistant organisms. So, we do know that nung na-discover yung antibiotics way back in the 1940s, it was really, there was a sense of it being a miracle drug. Kasi yung mga deaths and illnesses due to infections now became something that people and physicians and those in the healthcare industry are able to manage. So nag-increase yung life expectancy, no? Life became a little better because of the miracle drugs of antimicrobial agents. But as soon as na-discover yung antibiotics sa mga 1940s, actually already described a phenomenon called resistance. Sabi niya talaga na kung hindi tayo mag-iingat, very soon these miracle drugs will lose their potency because they will develop resistance. So, yan. So something like this. Meron, di ba nung panahon na yon, the most difficult of infections were due to Kasi war nung time na yun eh. So maraming mga skin infections from the injuries related to war. So Staphylococcus aureus is a bacteria that causes a lot of infections from wounds. So it was really, really good that they were able to find penicillin to try to counteract the Staphylococcus aureus. But as soon as na-discover yung penicillin, naka-discover naman yung organism na Staphylococcus aureus ng ways to become resistant to the penicillin. And so on and so forth. Habang nakaka-discover, nakaka-find ng new ways to fight the presence of new antibiotics. So that's how AMR is. They're very, very intelligent, these bugs, no? And they keep on like evolving and trying to find ways to counteract the good effects of antimicrobial resistance. So kailangan labanan din natin sila. So these are some of the more popular causes of antimicrobial resistance, yung nag-overprescribe na antibiotics, patients not finishing their treatment, being used in animal industry, when there are just so much infection in various places or lack of hygiene and poor sanitation, all of this have been seen to cause or increase AMR. In the hospital, we see or picture antimicrobial resistance like this. So, ibig sabihin, yung mga bilog-bilog dyan are antimicrobial discs. Now, dun sa left side, nung 1 decade ago, pag naglagay ka ng antibiotic, nagpo-form yung bacteria, tumatabi sila, and there's a sense of clearing, no? There's an area of clearing. Pero 1 decade later, in 2019, wala na. Kahit lagyan mo ng antibiotics, hindi na takot yung mga bacteria. There's no clearing anymore. And this particular demonstration from Harvard University showed us a really good way of looking at how AMR develops. So ginawa nila, they had this giant agar plate on the floor, and then they put, di ba, 0 dun sa bawat dulo. They started to put E. coli, di ba, naririnig nyo yung E. coli as a bacteria. Nagplant sila ng E. coli and they tried to see how this will behave. And then they increased the amount of antibacterial agents, yung antibiotic, habang pagitna ng pagitna. As you move closer to the center of the plate, there was an increased concentration of the antibiotic. And tinitignan nila kung magsa-stop yung E. coli. So this is how it looked like. So may bacteria sa bawat dulo ng plate. You would see for a while para magsa-stop yung E. coli, di ba? Pero makakakuha siya ng additional energy and then it will pass that concentration. And then again, pass the concentration. So parang palakas siya ng palakas, no? It keeps on developing more and more strength to fight off the increasing amount of antibiotic. So that's how yung evolution or mutations cause so much of the AMR. So if we do not fight or control the emergence of more AMR, there will be more deaths, lives would be lost, and sabi nga kanina, by 2050, 10 million deaths na per year ang cost ng AMR. And that's not very far away. That's only 29 years from now. And most of us would probably still be alive by then.
Hi there. Did you know that 70 years ago, penicillin saved countless lives in World War II? Fast forward to the 21st century, and the chief doctor in the UK calls for antimicrobial resistance to be put on the National Risk Register and be taken seriously. And the US government describes antimicrobial resistance as one of our most serious health threats. In Canada, outbreaks of superbugs frequently make headlines because they kill patients. Antimicrobial resistance isn't a new phenomenon. All germs have the ability to develop resistance, but the more drug exposure there is, the faster resistance develops in people, animals, and agriculture. We now face infections that are resistant to many, if not all, of our available drugs, and there is very little to look forward to in the antibiotic development pipeline. Since 2010, only 3 new antimicrobials have been approved for use in Canada. This means that we must manage these precious resources more wisely, like preserving clean drinking water or halting global warming. Inappropriate or unnecessary use of antimicrobials is often cited as up to 50%. Misuse of antimicrobials is risky to patients. It can increase mortality, time spent in hospital, and lead to collateral damage, such as a new infection with another bug, like C. difficile, a germ that causes diarrhea in most, but may cause serious or fatal infection in others. Using antimicrobials appropriately will not only help preserve our antibiotics, but will also improve patient outcomes and patient safety. Everyone wants to do the best thing for their patient. Sometimes that feels like wanting to give the strongest, broadest spectrum antibiotic. But we need to ask, is that really the best thing, not just for this patient, but the patients in the global community? We need to carefully think about why we are giving an antibiotic, what drug we choose, and how we're using it, dose and duration of therapy. We are falling behind the curve with the prevalence of multi-drug resistant organisms and the lack of new and innovative antimicrobials. Antimicrobial stewardship is just one facet in the efforts to improve outcomes among patients with infections and reduce the incidence of resistance. Everyone plays an important role as good antimicrobial stewards.
Yun na nga po, narinig nyo na everyone. So that's all of us, no? Kasi kung hindi natin labanan yung AMR, all of these things that are listed here, the deaths, the cost, and everything, all the complications may happen. So ayaw na natin dumating dun sa 2050 na we will be having all of these challenges. So let's start now, no? So, tapos nagdagdag pa yung COVID-19. So, this is really an additional, really like a life-changing threat to our health securities right now. So, ano naman yung naging response ng Philippines? So, very, very quickly lang para alam rin natin yung context. Hindi na to bagong-bago. So, we have been doing this for a while. And it's not just the Department of Health, it's an interagency committee on AMR. So actually maraming agencies kasama like agriculture, local government, DTI, science and technology, and more recently. So when we started off, merong naging national action plan. At from 2016 to 2018, parang marami na rin tayong na-achieve, no? And all of these are part of that. I think for me, ang pinakamahalaga ay na-recognize na natin yung drivers ng AMR. So we are already working on this. Yan, health providers, health industry, pati patients, we're trying to correct all of this already. And for me also, one of the pinaka-powerful na nagawa was this no prescription, no dispensing policy, no? Republic Act 10918, which made it impossible for people just to buy antimicrobial agents just right off the pharmacy. Tapos of course, nagkaroon na nitong mga other trainings, antibiotic guidelines, and infection control. So by 2019, nandun na tayo sa second phase of National Action Plan. And this is what we're doing. We're now expanding to include even people who are non-doctors. So kayo lang po lahat sa DepEd, meron kayong mahalagang parte dito sa preventing more AMR in our country. So ito po yung vision and mission of the new National Action Plan. And more or less, it's really just that we all have, parang we're in it together. It's an integrated, comprehensive, and sustainable approach to fighting AMR. Meron pong mga strategies na na-indicate at saka may mga targets. I'll quickly go through some of the known solutions para ma-inspire po tayo na ito yung tamang daan. No? So lowering demand for antimicrobials and reducing unnecessary use. Yun yung key concept. Kung mababawasan natin how much we need to use antibiotics, maybe there will be less AMR. So anong solution? Increase vaccination kasi kung mas maraming may vaccines like for COVID-19, for pneumonia, for measles, for all of those vaccines, no? Then mas konti siguro yung kailangan nating gamot for them. Tapos let's use more of the diagnostic tests para mas mabilis natin ma-diagnose kung meron tayong sakit. So rapid diagnostics will also reduce unnecessary prescription. Tapos number 3, yung mahalaga, yung concept ng AMS, Antimicrobial Stewardship. Ibig sabihin, kunyari, may sipon tayo, huwag na natin isipin na kailangan natin ng antibiotic kasi malamang sa hindi natin kailangan kasi nga viral infection yun. So we don't need an antibacterial agent against the usual colds. Mahalaga yung AMS kasi it really has a lot of benefits, no? So kung tama yung paggamit ng mga antibiotics, antimicrobial agents, we actually prolong their potency, nare-reduce adverse events, nare-reduce yung cost, and of course, nare-reduce yung evolution ng resistance. So, to do AMS, we've been training hospitals. Yan. So, dyan kami nag-umpisa. So, para at least lahat ng mga doktor, nurses, pharmacists, microbiologists, and other people in the healthcare industry will be part of AMS. Parang nagagawa na natin yan. Go na tayo dyan. And even when the COVID pandemic happened, the AMS trainings continued. There was a recalibration of the program. Tapos imbis na face-to-face yung mga workshops, we shifted quickly into a virtual platform. So hindi tayo na masyadong nawala sa track. Okay? Sasabihin niyo sa akin, hindi naman kami doktor, bakit kami nakikinig ng lecture sa'yo, doktora? Kasi now we know that fighting AMR goes beyond just the health facilities. There are many things many people can do. And number 1 is to prevent infections. Number 2 is to improve antimicrobial prescribing. And number 3 is always keep on getting educated on this topic. Preventing infections nga, if we have less infections, we will use less antibiotics. So, turuan natin yung ating mga estudyante, the youth of today, na maging panatiliin yung sarili nilang malakas. Labanan ng sakit, labanan ng mikrobyo, at kung pwede magpabakuna kung kailangan. Ano? So, this is like maybe one of the illustrations you can use. Pag malakas yung resistance, hindi papasok yung mga germs sa ating katawan, hindi tayo magkakasakit. Malamang hindi natin kakailanganin gumamit ng mga antibiotic. Tapos panay rin natin umpisahan kahit bata pa yung ating mga estudyante. Try to teach them na panay sundin ang payo ng mga doktor at huwag magdoktor-doktoran. Yun nga, marami sa mga illnesses actually don't necessarily need antibiotics, but who can say that other than our physicians? So, hintayin, magkonsulta sa doktor, hintayin ang reseta. Huwag mag-self-prescribe or self-medicate. At sometimes, siguro dapat talaga isipin natin na hindi naman tayo BFF, no? Best friends forever nitong mga bugs na to. Kailangan nga labanan natin sila. Hindi natin sila partner sa AMR. Sila ay kalaban natin at dapat sama-sama tayong united to preserve antimicrobials. So we can use a lot of these illustrations that are found in the WHO, diba? Yan, drug resistance, fight infection, prevent infection, keep ourselves clean, good hygiene. Yan po yung mga messages na pwede natin continuously finifeed sa ating mga students. Start them young para naiintindihan na nila at na-imbibe na nila yung good knowledge and attitudes. What our youth must know is that taking antibiotics when they are not needed can actually hurt your health, no? And other things, yung mga sharing antibiotics, sharing prescriptions, hindi yan dapat ginagawa. Tapos the other thing I'd like to just share with you is sobrang dami ring materials sa internet. So you could craft your messaging and your lectures to your students, yung age nila at saka kung ano yung present sa inyong community, what's happening around you. So you can tailor your messaging and your lectures. Meron rin yung website kung gusto nyo pong in Filipino or other languages yung inyong gagamitin na materials. Okay. Tapos, meron kasing very recent concepts in addition to what I've told you so far, no? Na ngayon, naiintindihan na natin na antibiotic use is not really just limited to human health, no? So, hindi lang ospital, hindi lang clinic, hindi lang dun gumagamit ng antimicrobial agents. Yun pala, it's just all over our communities, no? So, we needed a broader framework for AMR determinants. Hindi lang mga doktor ang salarin dito sa problemang to. Marami rin palang gumagamit ng antimicrobials at hindi necessarily tama lahat ng paggamit ng mga antibiotics na to. So there are a lot of people that really need to also be engaged in the fight against AMR. And that's what we call One Health approach, no? So ito po yung medyo bagong concept kasi nag-umpisa lang to nung last year, 2020 November. So AMR is not just about taking medicines when you are sick. It's really being vigilant around you, no? So yung kunyari, ano ba yung nasa paligid nyo? Yung tubig sa river, okay ba yon? Saan siya galing? Ano yung saan napupunta yung mga tubig galing sa mga ospital, galing sa mga farms, napupunta ba yun sa mga waterways natin like this? Tapos nag-feed ba yung ating mga animals with unnecessary antibiotics? So ito yung concept ng One Health. Medyo nagiging matunog na kasi siya. So we also need to have a good foundation on what One Health really means. And One Health is the collaborative effort of multiple health science professions to attain optimal health for people, domestic animals, wildlife, plants, and our environment. So parang mas tama na ngayon yung approach. Hindi lang mga doktor, hindi lang mga nurse, hindi lang mga pasyente, but whole of society to really be able to control AMR. So parang ganito na yung picture ngayon, hindi lang mga pasyente, pero pati yung mga animals, ano yung feed natin, pati yung food security natin, pati yung plants, tsaka yung environment. Okay? So even the WHO has already adjusted its all of its objectives and strategies so that it falls within the One Health response. Yan. So pag pinag-usapan natin ano ba yung driver ng AMR sa Pilipinas, hindi na lang siya overuse of antibiotics sa human health. meron ding misuse or overuse sa animal health and industry. Okay? So, kailangan tugunan natin to lahat kasi hindi natin masosolve yung problem kaagad. And on top of this, there's really no time to wait. We really need to secure our future starting today. Kasi magiging problema siya. So ngayon, hindi na lang WHO or World Health Organization, kasama na rin yung food and animal organizations tsaka environmental groups so that together we can fight against AMR. At hindi na lang talaga mga ICAMR, iniimbita na rin namin pati mga tao outside human health and animal health. And that's why we really need you also, our partners in DepEd and CHED. No? So what's needed? Political commitment and good governance, increasing our capacities, human and animal health sectors, and collaboration with a lot of stakeholders, particularly those who can reach our youth today, which is you. So ito po yung isa sa mga last kong slides, and I wanted to show you this is where you come in. In the overall scheme of things in our fight against AMR, mahalaga po talaga yung increase awareness, yung hashtag increase awareness and behavioral change. And I think kayo po yung parang pinakamalaking force to do that and help us with that. So awareness campaign, school education, and continuing education. Okay, so very thankful po kami na you got involved in the WOW of 2021. Medyo na-delay lang tayo pero ito po yung naging roadmap namin. So roadmap nating lahat. So marami ng groups, hindi lang human health, hindi lang animal health, but so many agencies and stakeholders got involved. And we welcome you. We're very, very happy that we found new, very active partners. Ito pong 3 bullets at kayo bilang pang-4 na bullet. Lahat po ito nasa education. So, COHUN is Southeast Asia One Health University Network. PhiloHUN is Philippine One Health University Network. So, the whole of academe is now with us, particularly DepEd, no? So, ito po, increasing ang partners natin, and we look forward to your participation and engagement not only this year but all the years to come. Ito po yung breadth and scope ng COHUN. So hindi lang siya One Health siya sa iba-ibang countries in our part of the world: Cambodia, Indonesia, Laos, Malaysia, Myanmar, Philippines, and Thailand. Tapos parang kailangan din maging clear sa ating vision, ma-include yung youth, start them early, and hopefully you can help and you can be the bridge for all of us to reach the youth. The youth of today are our hope for tomorrow. Okay, so may contest similar to the contest of DepEd. Nag-contest din itong youth leader na to, medical students for social relevance ang kanilang pangalan, and they were very, very, very engaged in the during the WAAW WOW 2021. So they formed this Youth Against AMR. So we're very happy. So just to end, don't forget, spread awareness, stop resistance. Ito po yung way for us to move forward. Do your part to reduce AMR, not only in your homes, in your community, in our country, and the whole global world. No? So now is the time for all of us to begin getting involved in the fight against AMR, regardless of where you are, regardless of your situation, regardless kung may COVID pa, dapat talaga mag-start na po tayo. And AMR will affect our children and our children's children. So, join us at sumama sa laban ng AMR. Thank you very much po. If you have questions, just email me kung wala na tayong time. Thank you.
Okay. Thank you so much, Dr. Berba, for that very informative and significant discussion. I'm sure our teachers, and not only our teachers, but our supervisors here in this Zoom platform and our learners who are also watching this afternoon have learned so much about antimicrobial resistance, or AMR, from that very comprehensive discussion. So thank you very much po, Doc Nina, for being with us this afternoon. Now, allow me to welcome our equally good second speaker, and we are so honored to have her, Ms. Johanna B. Mallari, Pharmacist 4 of the Pharmaceutical Division of the Department of Health and Program Manager of the DOH Program to Combat Antimicrobial Resistance. She will discuss with us how antimicrobial resistance concepts and awareness may be integrated in the classroom and in our assessments for our younger learners or for our elementary learners.
Good afternoon, everyone. May I confirm if you can see my slides?
Yes, ma'am, we can po.
Again po, good afternoon. Thank you, Ms. Meline, for that kind introduction. So first of all po, on behalf of the Department of Health Pharmaceutical Division, we would like to thank the Department of Education for organizing this webinar in celebration of the World Antimicrobial Awareness Week, or WAAW, and of course for inviting us to be here. This is actually my first time to speak in front of an audience of teachers, but I am a pharmacist po by profession, but my mom and a lot of my relatives are actually teachers. So I have very high respect for teachers, and I am greatly humbled by this opportunity to present before you. So this is the outline of my presentation. So earlier we learned from Dr. Regina Berba the basic concepts of antimicrobial resistance and why it is important that you become involved, that you join us in this fight against AMR. So in this discussion naman po, we will be discussing the role of teachers in students' education. So parang i-reiterate lang natin kung ano yung important role ng teachers and how you can incorporate concepts of AMR in your lessons with your elementary learners. So first off po, sa unang topic natin, the role of teachers in students' education for antibiotic use. So as we have learned from Dr. Berba, AMR or antimicrobial resistance is a global public health threat. No? So sabi nga po ni Doc Berba, matagal na natin siyang problema, and this problem is driven by misuse and abuse of antibiotics or antimicrobials in general. So therefore, there is a need for urgent action, and that includes educating our public and primary care professionals on the proper or correct use of antibiotics in order to secure long-term availability of effective antibiotic treatments. So we have to make as many people as possible aware of this misconception. So may mga misconceptions po kasi tayo, no, sa paggamit ng antibiotics and yung treatment ng mga infection. So we have to correct those misconceptions and transform the perceptions of people towards prudent use of antibiotics. And yung act ng pag-transform is more difficult than shaping ideas. So kaya po gusto natin as early as possible, no, during the early ages of learning, matutunan na natin yung concepts ng antimicrobial resistance and yung tamang paggamit ng mga antibiotics para ma-change natin yung concepts or yung mga public awareness and ma-reduce yung misuse ng mga gamot na ito para ma-improve din yung knowledge ng general public on how to fight pathogens correctly. So therefore, teachers, you po, our teachers, you have a very crucial or great role to play in looking for strategies to effectively help students on the shaping of ideas and developing attitudes towards the prudent use of antimicrobials. So for now, this afternoon, we have elementary teachers. And so very bata po, no, yung mga tuturuan natin. And yung concept ng antimicrobial resistance is a very technical term that even adults may find difficult to understand. So sa discussion po natin ngayon, tatry natin no, na i-relate yung topic kung dun sa mga terms na maintindihan ng mga elementary learners. So yung mga bata, even before they go to school, may mga deeply rooted conceptions and ideas na po sila, di ba? Na nakuha nila from their context of everyday life. So for example po, I have a 2-year-old niece, and as early as now, tinuturuan ko siya dun sa concept ng germs. At pag susubo niya yung kamay niya, sasabihin ko lagi na kailangan niyang maghugas ng kamay. So yung mga ganitong concept po or ideas, nade-develop na yan during formative years. Yung nakikita nila sa mga magulang nila, sa mga kapatid nila. Pero paano po kung yung matuturo or makikita nila ay yung hindi tama, di ba? So dun po papasok yung role ng mga teachers. Dapat pagpasok nila sa paaralan, makakorrect natin yung mga misconceptions or yung mga incorrect practices or behavior na yun. So the DOH Pharmaceutical Division actually requested for technical assistance from the World Health Organization. So before po, nagpa-develop kami ng parang mga materials. We have long been wanting to integrate the concept of AMR in the basic education classroom kasi nga po na-recognize namin yung importance na mapaunawa agad sa mga bata kung ano yung tungkol sa antimicrobial resistance. So ang isi-share ko po ngayon sa inyo is yung material na yon na dinevelop, no? So medyo magiging lengthy lang po yung discussion natin. I beg for your pardon. So this topic I will be presenting yung content natin is about understanding germs and antimicrobials. So sa mga bata, mas familiar sila dun sa concept or dun sa term na germs, no? So pwede po ito for grade 2, magsa-start siya sa grade 2, pero all throughout ng elementary or ng primary education, pwede siya i-reiterate yung mga concept na matututunan natin mamaya. And then we would like to demonstrate appreciation of good health habits. So i-insert po natin siya no, dun sa pagpapaalam or pagpapaalala sa mga bata ng good health habits para maiwasan yung pagkalat ng germs. And then performance standards will be practices will be so that they will be able to practice good health habits to prevent spread of germs. And yung gusto nating makuha na learning outcomes or learning competencies is that they will have awareness dun sa concept of germs and to be able to differentiate bad habits in relation to antimicrobial resistance. So in my presentation po, so for the next learning outline natin on understanding AMR, so for primary education, our focus will be on understanding germs and antimicrobials. So itong superbug, kasama siya dun sa naging quiz nyo kanina, no? So maaari pong familiar na yung iba sa inyo dito, maaring hindi pa, pero this term is used to refer to resistant pathogenic microorganisms or germs, especially bacteria. So at a very young age, we can make our elementary learners aware of the idea of germs and yung general properties that they possess. So for example po, yung relative size nila, prevalence in nature, and yung capacity nila to induce contagious or infectious diseases. So as mentioned po earlier, no, yung topic ng AMR is very complex, so it might be difficult to make our elementary learners understand. Kaya yung magiging strategy natin as teachers of elementary learners, we have to make use of metaphors and express sizes. So parang papaganahin natin yung imagination ng mga bata, and we have to express sizes in scales relatable to children. So for example po, we can we can describe bacteria or mga microorganisms or germs as so tiny, sobrang liit, such that hindi sila basta-basta makikita ng gamit lang yung mga mata natin. So we can also say that viruses are even smaller than bacteria. So it is also important po that we relate these concepts to real life experiences to further illustrate yung abstract concepts. So in the next set of slides, I will be showing the material po that we can use. So parang magkukwento po tayo. Kwentuhan natin yung mga estudyante tungkol dito sa antimicrobial resistance at yung importansya ng paggamit ng tama at wasto ng mga antimicrobials. Okay? So yung general objective po natin is mag-develop tayo ng awareness dun sa problem ng AMR and kung ano yung mga possible na positive behaviors and health practices na pwedeng mag-contribute para ma-lessen yung progression and spread ng antimicrobial resistance. So the story goes like this. So once upon a time, there lived a boy named Muy. So si Muy, siya po yung nakasilip dun sa door. Siya yung nakikimarites, nakikiusyoso dun sa kung ano yung nangyayari dun sa kwarto. No? So si Muy ay isang 9-year-old na bata. No? So meron siyang younger sister. Pangalan ng younger sister niya, si Lexi. So si Lexi, yung younger sister, may sakit. So of course, nalungkot si Muy kasi hindi sila makapaglaro ng sister niya kasi binabawalan siya ng magulang niya na lumapit sa kapatid niya kasi baka magkasakit din siya or mahawaan siya ng sakit. So dito po sa concept ng contagious or communicable diseases. So when we say communicable diseases, so these are diseases that spread from one person to another through a variety of ways that include contact with blood or bodily fluids such as yung laway, sipon, breathing in an airborne virus. So for example po, di ba si COVID-19, yung mode of transmission niya is airborne or by being bitten by an insect. So sinasabi natin dito na may mga ibang infection na maaaring nakakahawa sa iba. Kaya si Muy, pinagbawalan siya ng magulang niya na lumapit kay Lexi kasi baka mahawaan din siya. So the story continues. Nakita ni Muy na every day since Lexi became sick, nakikita niya lagi yung mommy and daddy niya na pumupunta dun sa room ni Lexi para painumin siya ng gamot, specifically sa morning, lunch, and paggabi. So one night, naisipan ni Muy na makiusyoso. So sumilip siya dun sa kwarto ni Lexi, no? Kasi namimiss na niya yung sister niya. So he cares very much about his sister and miss na niya siyang makalaro. So naiintriga siya, ano bang meron dun sa sister niya? Bakit hindi pwede maglaro? So when it was time to take Lexi's medicine, nakita ni Muy na ay sumilip si Muy, no? Nakita niya na binibigyan ng magulang niya si Lexi ng isang pill. Okay? So, nung sumilip siya, na-direct yung attention niya dun sa maliit na pill na yon. So, naisip niya, what is this colorful thing that mama is holding? So, kasi nakita niya na pinapainom dun sa kapatid niya, di ba? So, it must have come from that bottle, sabi ni Muy. So, sabi niya sa isip niya, so sisilipin ko nga mamaya kapag umalis na sila mama and papa. So during the course of this interaction or discussion with your students, you can also engage their participation po. No? You can ask questions like, ano sa tingin nyo? Ano kaya yung colorful pill na yon? So could it be a toy? Could it be a medicine? Is it a food? So just to also make them parang mapapagana din po yung isip nila. Ano kaya yun? Ano kaya yung nakita ni Muy? Okay, so the story continues. Pinuntahan na ni Muy yung, kumbaga nakapasok siya dun sa kwarto ni Lexi habang tulog si Lexi and nakita niya yung bote, nabasa niya antibiotic. So sabi ni Muy, I wonder what it does. No? So dito sa part na to, i-introduce po natin yung concept ng antimicrobial. So nakita kasi na may antibiotic, di ba? And dito sa part na to, introduce na natin yung concept ng antimicrobials. So antimicrobials can actually be we can actually break down the word antimicrobials para mas madali po natin siyang i-explain. So when we say anti or anti, it means against. So sa Tagalog, laban. Diba? So yung microbials naman po are relating to microorganisms or microbes or sa common, mas kilala sa layman's term na germs and worms. Lalo na sa mga bata, kilala nila yung mga germs and worms. So pwedeng yun po yung gagamitin natin na term pag i-explain sa kanila. So yung mga microbes or germs, they can refer to bacteria, viruses, they can actually also refer to fungi, parasites, so yung mga pinakita po sa inyo kanina ni Dr. Berba. So these antimicrobials, when put together, it means that these are agents that are used against or laban sa microorganisms, laban sa germs. So panlaban sila sa infection na dulot ng mga germs or ng mga bulate, worms, okay? So mga gamot po sila, okay? So i-explain natin na yung mga antimicrobials, they can actually kill or inhibit the growth. So when we say inhibit the growth, hindi na sila lalaki pa or dadami pa para makontrol yung spread ng microorganisms or yung spread at paglala ng infection. Okay? So, nung hinawakan ni Muy yung pill, so ngayon po, gagamitin natin yung imahinasyon natin. And papagamit din natin sa mga bata yung imahinasyon nila dun sa mga gustong-gusto nila na parang mga animated or mga superhero na na mga way ng pag-explain ng bagay. Okay? So, something mysterious happened. Gumalaw daw yung pill. So, sabi ni Muy, what is happening? It's coming to life. Tapos, nagulat siya nung biglang lumaki yung pill, yung gamot, si antibiotic. And then, nagpakilala sa kanya as Captain Antibiotic. So, sabi ng antibiotic, hello, Muy. Ako si Captain Antibiotic. So, sabi niya kay Muy. And then, in-explain ni Captain Antibiotic na I am here to help Lexi fight off her illness, no? So, in-explain niya. And then, of course, si Muy, bilang concerned siya sa kapatid niya, he was delighted that someone as powerful as Captain Antibiotic is going to help her sister, na si Lexi. So, gusto din niyang magkaroon ng part. Parang gusto rin niyang maging involved para i-combat yung illness ni Lexi. So, when Captain Antibiotic asked him if he is ready for an adventure, dali-dali namang sinagot ni Muy na of course I am, parang ganon. So na-excite siya. So dito sa part na to, i-introduce po natin yung concept ng germs, no? So na yun nga po na yung mga germs are tiny microorganisms or microbes. They are very tiny that they cannot be seen by the naked eye or by the human eye. So, merong mga ibang klase ng germs or microorganisms na hindi harmful. So, for example po, meron tayong natural na natural bioflora sa tiyan natin. Pero merong ding ibang klase ng mga germs or ng microorganisms that can cause infectious diseases. So, yun yung aalamin ngayon nila Muy and Captain Antibiotic. So sabi ni Captain Antibiotic, kailangan lumiit muna tayo para makapasok tayo dun sa katawan ni Lexi. And then let's look at the invaders that are causing Lexi's illness or discomfort. So as they were about to enter the body of his little sister, so yun yung naging mission nila. Hahanapin nila ano yung mga invader na nagkakos ng sakit ni Lexi, okay? So the boy, si Muy, and Captain Antibiotic magically shrunk and entered the sick girl's body. So the captain and the boy surveyed inside the body of Lexi. No? So they traveled through the blood stream like sailors cruising the ocean. So hinahanap nila kung ano yung mga invaders. No? So sabi ni Muy, ano ba yung hinahanap natin? Ano exactly yung hinahanap natin? And then, sabi ni Captain Antibiotic, in-explain niya that we are looking for bacteria. So, in-explain ni Captain Antibiotic that bacteria are small, one-celled organisms that can be dangerous when they cause infection and illness to the body. So, nakarealize ni Moy na yung bacteria ay isa siyang klase ng germ, no? As the captain was describing it. So he remembered that back in kindergarten, her favorite teacher, si Miss, pangalanan nating Miss Amelia, taught about proper hygiene and nutrition and which can prevent the infections caused by germs like bacteria. So, pwede natin tanungin yung mga estudyante. So, ano ba yung isang bacteria? So, alam na natin na ang bacteria ay isang klase ng germ. So, ang germ ay nagdudulot ng sakit. So, dito po, i-introduce natin yung concept that bacteria are examples of microorganisms or microbes or germs. And other microorganisms include viruses, fungi, parasites. So, ibang klase pa yun. But for this particular story, ang hinahanap nila ay mga bacteria. Okay? So the story continues. Nakita na nila finally yung location kung saan nagpaparami yung mga bacteria. So sabi ni Captain Antibiotic, gotcha. So nakita na niya. And then dito po, gusto nating i-introduce sa mga learners natin that infection occurs when a microorganism such as a bacteria, if they are able to successfully invade or enter susceptible parts of the body. So nangyayari po yun lalo na kung mahina yung resistensya or yung immunity ng katawan. So nagkakaroon talaga ng mga infection kapag may mga microorganism tulad ng bacteria na nag-invade sa katawan ng tao. So nakita, in-explain ni Captain Antibiotic kay Muy na yung mga bacteria, they multiply really fast. So mabilis silang dumami. And they become dangerous as they emit toxins that are harmful to the body. So natakot si Muy, no, dun sa site ng mga bacteria. So dito rin po, i-explain natin na yung mga bacteria and other germs, they can proliferate or they can multiply. Pwede silang magparami sa loob ng katawan. And habang dumadami sila, of course po, mas magnified yung mararamdaman na sakit, na signs and symptoms ng pasyente. So they can cause harm to the body. So yun yung reason, kapag dumadami sila or nagpa-proliferate, yun yung reason kung bakit nakakaramdam tayo ng sakit, katulad ng lagnat, sipon, ubo, at kung ano pa mang sign and symptom na cause ng infection. So since natukoy na nila yung location ng mga bacteria, sabi ni Captain Antibiotic, so wag na tayong magpaligoy-ligoy pa, wag na tayong magtaksayan ng panahon. Let's target those bacteria before they take over Lex's body. So bago pa man sila dumami ng dumami, patayin na natin yung mga bacteria na ito. So the brave warriors approached the hideout immediately, and the captain pulled out his antibacterial gun. Okay, so this is a powerful weapon, specially designed to kill infectious bacteria and prevent their multiplication. So kapag ginamit sila in the right power level, they are effective against germs and against the germs that are invading Lex's body. So dito po sa part na to, explain natin yung concept that antibiotics, so yung mga antibiotics, tinatawag din po silang antibacterials. So from the name itself, antibacterial, they work against bacteria. So yung mga iba't ibang klase natin ng antimicrobials, may mga very specific action po yan na ginagawa. So kapag sinabing antibacterial, mag-work lang talaga siya against bacteria. So hindi siya pwedeng mag-work against viruses or against fungi. So sinasabi din natin dito na kailangan appropriate or tama yung amount na gagamitin para maging effective yung antibacterials or antibiotics natin against bacterial infections. So what I am showing you here po is yung kung paano natin i-explain dun sa mga bata, no? Using their imagination. Very graphic po kasi lalo na pag mga bata, gusto nila more than just explaining yung mga concepts, no? Parang gusto nila, may nakikita sila, no? May imagine sila. Kaya yun, dun po natin sila, dun sa kung saan sila makaka-relate. Syempre po, yun yung gagawin natin na strategy. So sabi ni so since na-confirm na yung site of infection, tumawag na ng backup si Captain, anong tawag niya? Captain Antibiotic. So hindi niya kayang mag-isa, kailangan niya ng backup, no? So troops of other antibiotic warriors came to the rescue as their captain confirmed the site of infection. So sabi ni Captain Antibiotic, this is going to be a long battle. So kasi hindi basta-basta mauubos or mapupuksa yung mga bakterya kasi nagparami na sila, di ba? So sabi ni Muy sa sarili niya, yun nga, this is going to be a long battle. And then nakapansin niya, there are so many enemies, tapos nagmumultiply sila, nagpaparami sila ng mabilisan. So i-emphasize po natin dito na kailangan ng right amount of antibiotics para mag-produce ng desired therapeutic effect. So kaya di ba si Captain Antibiotic, hindi naman siya mag-isa lang na lumaban dun sa mga bacteria, dun sa mga germs. Tumawag siya ng backup kasi hindi niya kayang mag-isa. Kailangan tama po yung amount na iti-take para ma-achieve yung desired therapeutic effect. Okay? So yung so tuloy ang laban, the antibiotic warriors are giving their best to combat the colony of bacteria that invaded Lexi's tissues or Lexi's body. So pinapanood dito ni Muy, no? Parang, boom! Naglalaban sila, yung mga bacteria and yung mga antibiotics. And then after ng labanan, so sabi ni Captain Antibiotic, it's almost 8 hours after the first wave. So our force is getting weaker. So syempre during the course of the battle, may mga napapatay silang bacteria, may mga bacteria rin na nakakatalo sa kanila. So sabi niya, send more troops. So kailangan natin ng additional na backup. So after that, no, biglang naisip ni Muy, they need more help, no? So they need help. So Captain, where did he go? Tapos parang yun na, nagising na siya. So panaginip pala yung nangyari. So parang nananaginip pala siya. So nagulat si Muy, nagulantang siya. So sabi niya, panaginip lang ba yun? So sabi niya, he vividly remembers yung message sent by the captain na kailangan nang mag-send ng panibagong backup or ng more troops of antibiotic warriors. So sabi niya sa sarili niya, who's winning the war? So kailangan tulungan ko si captain to call up more soldiers. No? So the boy is so sure that he saw how antibiotic warriors have been combating infectious bacteria inside Lexi's body. So sabi niya sa sarili niya, I must check if Lexi is taking her medicine on time. So tingnan ko nga kung uminom ulit si Lexi para may dumating na bagong backup ng antibiotic warriors na lalaban dun sa bacteria. So pumunta, so nag-rush or tumakbo si Muy papunta sa kwarto ni Lexi, and he was glad to see that their mom and dad is already letting Lexi take her next dose of medicine. So since then, so mula nung nakita ni Muy yung mga pangyayari and kung paano pina-fight off ng antibiotics yung mga bacteria, sabi niya sa sarili niya, I will make sure that Lexi is taking her medicine correctly. And dapat din, she gets proper rest. So aside sa pag-inom ng gamot, kailangan makapagpahinga siya, kailangan kumain siya ng masustansya. So Muy also made sure that he keeps himself healthy. So sabi din niya sa sarili niya, ayoko rin na magkaroon ng bacteria sa loob ng katawan ko. So dapat ako rin, I should rest well and I should eat healthy food, healthy, nutritious food, so he won't get infected as well. So parang during the course of the discussion, we can ask our we can ask our learners po, no, from time to time kung ano yung mga napipick up nila. So for example, we can validate if they were able to understand by asking if tama ba or mali na kapag nagkasakit ka and you may get infected or you may get sick when you come in contact with an infected person, or tama ba or mali na dapat iinumin ng at the right amount yung mga gamot. So pwede po natin silang itanungin from time to time. We can ask them questions just to make sure na naiintindihan po nila yung mga concepts na in-explain natin. So sinasabi rin po natin dito, gusto rin natin i-emphasize na aside from taking the correct dose, kailangan din ng tamang nutrisyon, no? Drinking lots of water, getting enough rest. So hindi sufficient or hindi tama na iasa natin lahat dun sa gamot. So dapat tutulungan din natin yung katawan natin na mapalakas yung resistensya, mapalakas yung immunity para mas madaling malabanan ng katawan natin yung infection. So therefore, i-emphasize natin dito sa part na to yung importansya ng good hygiene practices. Because such as yung simple washing of hands, before eating, okay, washing of hands after eating, and then every time nalalabas, make sure na proper yung hygiene para ma-prevent yung pag-spread ng infection. And then, meanwhile, since uminom si Lexi ng gamot, more troops came to the rescue and Captain Antibiotic is leading the antibiotic warrior towards victory, and powerful antibiotic tanks charge through the enemy's territory to neutralize the bacterial army. So dahil tama yung pag-inom ng gamot ni Lexi at minake sure yun ng mga magulang niya at ng kuya niya na si Muy, so na-fight off effectively yung infection na dulot ng bacteria. So ipapaliwanag din po natin dito na kapag sinabi ng doktor na iinom ng antibiotics sa loob ng 7 araw, 3 times a day, kahit na bumuti na yung pakiramdam sa ikatlo or ika-4 na araw, kahit na mag-subside yung mga symptoms days after taking medicine, it is important to complete the whole therapy. So possible po kasi na yung mga bacteria, magiging dormant lang sila or papahinga lang sila saglit, pero after some time, magre-relapse sila, no? So as the body's immune system becomes weaker. So it is very important na aside from taking the right amount of antibiotics, iti-take din siya ng kompleto. Okay? And then taking antibiotics at the right time will help in eliminating bacterial invaders during infection. So sabi dito, si Kuya, Mommy and Daddy did a great job in ensuring that Lexi gets the proper dose of correct medicine while she was sick. So we should emphasize that proper intake of antimicrobial agent means that they are administered in the right dose and quantity at the right time and using the proper mode of administration throughout the entire duration that has been prescribed or inireseta ng doktor. So yung mga gamot po, especially yung mga antimicrobials natin, they are very complex na healthcare tools na ginagamit natin to fight off infections. And when they are taken in the correct manner, they provide critical health benefits, no? So very effective po sila, provided na gagamitin natin sila ng wasto at tama. So it is very important to read and to follow yung prescription ng doktor. And kung ano rin yung mga labels na nakikita natin sa mga gamot to ensure that they are taken properly. So dahil tama yung pag-take ng gamot ni Lexi, gumaling na siya, no? So naging magaling na si Lexi after several days of correctly taking her antibiotic medicines. So sabi ni Lexi, okay na ako, malakas na ako. So and then of course, si Muy, naging masaya siya kasi okay na yung sister niya. So sabi ng mommy and daddy niya, very good ka Lexi kasi tinake mo ng tama yung mga gamot mo. So may iba po kasi bata no, na ayaw inom ng gamot. So especially pag antibiotics, kailangan po i-make sure talaga natin na inumin nila yung mga gamot. So of course, masayang-masaya si Muy kasi makakapaglaro na sila ulit kasi wala nang sakit yung kapatid niya. So dahil doon, sabi ni Muy, thankful siya, no? Nagpapasalamat siya kay Captain Antibiotic kasi na-save si Lexi from bacterial invaders. And then sabi ni Captain Antibiotic naman, hindi kami yon. Parang we should be thanking all of you, ikaw, mami mo, and daddy mo, kasi kung hindi kayo, if it weren't for your help in ensuring that Lexi consistently and properly takes her antibiotics, we would have lost the battle, sabi ni battle, sabi ni Captain Antibiotic. So tapos kinwentuhan ni Captain Antibiotic si Lexi nung mga naging misadventures nila sa paglaban sa infection. So sabi niya, there was a time before na hindi ako naka-receive ng backup kasi hindi continuous yung pag-inom and hindi at the right amount yung pag-inom ng pasyente. So dahil doon, nag-fail yung mission, natalo sila ng mga bacteria kasi hindi sila enough, wala silang backup, kulang sila, no? To fight the numerous bacteria. So na-outnumber sila, so natalo sila. So this usually happens when people don't follow their prescriptions appropriately, he further explained. So in-explain ni Captain Antibiotic. So tanong natin yung mga bata. So when antibiotics are not taken in the right amount and time, they become ineffective. Is that true or false? So sa inyo rin po, no? I-check din natin. So true or false po ba na kapag hindi tinake ng tama yung antibiotics at the right time and at the right amount, magiging ineffective sila? So just type in the chat box po, no? So dito po gusto nating i-emphasize that yun nga po, no? So ulit-ulit i-reiterate natin para may make sure na makaka-capture po nila or kukuha nila yung message na yung mga antibiotics kailangan iti-take sila sa right amount and time in order to be effective. So it is also incorrect to take twice the dose. Kung may missed dose naman, it is also incorrect to take twice the dose to compensate. So only take the prescribed amount of medicine as prescribed by your doctor. So kung hindi naman po sigurado kung paano yung gagawin, kunwari nakamiss ng dose, i-consult yung doctor or yung pharmacist, no? Kung nasa community po at outpatient yung pasyente, hindi siya naka-admit sa hospital, so pwede natin i-consult yung doctor, natatawagan natin sila, or magtanong din po tayo sa mga iba nating healthcare providers na malapit sa atin. Tapos, shinare pa ni Captain Antibiotic na may mga instances din kung saan the captain and his troops were sent to antiviral mission. So ang nangyari naman during that time, kinukwento ni Captain Antibiotic na yung pasyente, yung bata, may viral infection siya. So ibig sabihin, yung infection niya, ang nag-cause or yung nagdudulot is virus, no? So isang virus. So virus is another type of germs. Tapos, antibiotic yung binigay. And antibiotic do not work against viruses. So, nag-fail din yung mission. So, parang nag-waste lang ng money, at the same time, nag-waste din ng resources and time. So, resources, so money, time, effort, no? Kasi nga, binigyan ng antibiotic, pero hindi naman gagana yung antibiotic dun sa particular microorganism or germ na nag-cause ng infection niya. So we would like to emphasize here that virus is another type of microorganism or germ, and antibiotics are useless against viral infections. So as such, it is not right, parang it is incorrect to use antibiotics against viral infections such as common colds and other viral infections na self-limiting. So gagamit lang po tayo ng antibiotics sa mga possible po na may viral infection na nangangailangan din ng paggamit ng antibiotic kung may malinaw na ebidensya na meron din siyang bacterial co-infection. Pero kung talagang virus lang, such as yung mga common colds natin, mga flu, na virus yung nagpo-cause, so hindi po gagana yung mga antibiotics dyan, no? So yung gagamitin natin in that case, kung talagang kailangan mag-take ng gamot, ay mga antivirals. Kasi yun yung gagana against viruses. Okay? Tapos kinwento rin ni Captain Antibiotic na may isang beses din na natalo din yung troops niya kasi pinadala naman sila sa isang mission na kung saan ang kalaban nila ay mga parasites or mga helminths, for example. So antibiotics cannot do anything against parasites too. No? So the antiparasitic army should have been summoned during this kind of battle. So as mentioned earlier po, no, very specific po yung mga iba't ibang klase natin ng antimicrobials. So yung antimicrobials is the more umbrella, more encompassing term. And pag sinabi nating antimicrobial, they can refer to antibacterials or antibiotics, antivirals, antiparasitics, antifungals. So ang ibibigay po na gamot is kung ano yung naakma dun sa nag-cause ng infection. Okay? So yun din po yung ipapaunawa natin sa mga bata through this illustration. So sabi din ni Captain Antibiotic, so kumbaga inisa-isa lang niya yung mga naging bad experiences niya before na kung saan pinadala din sila sa anong tawag dito? Sa isang mission na kung saan ang nag-cause ng infection ay isang fungi. So antibiotics are no match against fungal infection. So no matter how many antibiotic troops are sent, they won't work against fungi or fungal infection. So yung dapat na ipinadala po dito sa pagkakataong ito ay mga antifungals. Okay? So may kanya-kanyang mga gamot na naayon kung ano yung nag-cause ng infection. So kung fungi po yung nag-cause ng infection, antifungals ang kailangang gamitin. Tapos, in-explain ni Captain Antibiotic na yung thing here, no, aside sa hindi na nga sila mag-work, so for example, nung time na pinadala si Captain Antibiotic and yung troops niya dun sa isang viral infection, aside sa hindi nga nila mapupuksa yung infection, ang nangyayari pa, itong mga germs na ito, so for example, in that case, yung mga viruses, no, or mga they parang sinuspy nila, sinisilip nila, nakikita nila ano ba yung mga mechanisms na ginagawa ng mga gamot na ito para puksain yung mga infection na dulot ng mga germs na yon. So kumbaga, nakikita nila no, yung mga ginagamit nilang mechanism such as yung kanina, yung pinakita sa illustration, may antibiotic gun sila. No? So nakikita na nila yung mga armas na ginagamit ng mga gamot or antimicrobials natin. So the next time that they come in contact with that particular antimicrobial agent or say antibiotic, alam na nila kung ano yung gagawin nila. Nag-develop na sila ng mechanism kung paano lalabanan yung action ng antimicrobial agent na yun. So ang tinatawag natin dito, nagiging immune na sa antibiotic. So nagde-develop po sila ng mga resistance mechanism. So yun yung tinatawag natin na antimicrobial resistance. So kahit sa anong warrior, kapag hindi sila ginamit ng tama, maaari pong mag-develop ng antimicrobial resistance. And tulad nga nung pinaliwanag po ni Dr. Berba kanina, yung antimicrobial resistance is the ability of microorganisms or microbes or germs to survive or to multiply despite the presence of antimicrobial. So parang nagso-survive sila, no? Nagiging immune na sila dun sa antibiotic po. And this can be harmful to us because dun magde-develop yung tinatawag natin kanina na superbugs, no? So yung superbugs, as we said earlier, it is a natural process of evolution, no? When they are parang nag-e-evolve sila to develop mechanisms para hindi sila mamatay dun sa mga ginagamit natin na pampatay sa kanila. So sabi nga po natin, no, what doesn't kill you make you stronger. So for example, the first time na nag-encounter si microorganism and si antimicrobial, pag hindi napatay fully ni antimicrobial si microorganism, naging stronger siya, nag-develop siya ng mechanism para mas maging strong, para next time na makaharap niya ulit yon, hindi na ito tatabla, wala nang effect. So kapag po hayaan natin na ganon, even our most mild infections, mahihirapan na tayong i-address. No? So imagine a world where antimicrobial warriors are no longer powerful against all kinds of microorganisms. So nakakatakot po yun, no? Kasi yun nga po, even sa mga mild na infection, hindi natatabla yung mga antibiotic natin. And we should not, of course, we should not let that happen. We will not let that happen. So kaya nga po, gusto naming ipaalam sa lahat that antimicrobial resistance is a global health concern. So isa po itong problema hindi lang sa Pilipinas, kundi sa buong mundo. So kung hindi po tayo gagawa ng aksyon ngayon, it is estimated that by the year 2050, 10 million people worldwide will die every year due to AMR. So bakit po sila mamamatay? Kasi nga, kahit sa mga simpleng infection nila, hindi natatalab yung mga antibiotics or mga antimicrobial agents na meron tayo ngayon sa merkado. And ayaw po natin mangyari yun, no? Parang yun po yung tinatawag natin na post-antibiotic era. So it means that there is a possibility that a time will come when common infectious diseases such as yung mga tuberculosis, pneumonia, HIV or AIDS, malaria, or even minor infections will become untreatable with our current medicines. And it means that more people will become sick and they will become sick longer kasi nga wala ng mga gamot na pwedeng gamitin panlaban dun sa infection, and their sickness will become untreatable. So we would not like that to happen. That's why ngayon pa lang, as early as now, we have to act na po, no? And we cannot act alone. Parang as mentioned po kanina, we have to act together, no? Bawat isa po sa atin may role na kailangan i-play. So dahil dun sa naging courage and strength ni Muy, nag-demonstrate sa pag-assist sa antimicrobial warriors in combating infectious invaders, he was awarded a Medal of Honor and he became a certified antimicrobial resistance or AMR warrior. So we would like to emphasize here that AMR affects all. So hindi lang ikaw, hindi lang ako, kundi yung buong society natin. And it is driven by interconnected factors. So some isolated interventions have limited impact. So kahit na may gawin po kami sa human health sector, kung for example, hindi po tayo gagalaw sa ibang sektor ng gobyerno kung saan nakakapekto din yung AMR, limited lang po yung impact na magagawa natin. Kaya nga, as mentioned po kanina, kailangan natin ng collaborative One Health approach, coordinated action to minimize the emergence and spread of AMR. And each individual, no matter how little our efforts are, kahit estudyante, guro, healthcare worker, community worker, lahat po tayo may responsibilidad at may pwede tayong gawin to contribute in winning this war against AMR. Kasi at one point in time, lahat naman po tayo nagiging pasyente and may posibilidad na mabibigyan din tayo ng mga antibiotics or antimicrobial agents na ito. So kung tama yung paggamit natin, that's already a great contribution dun sa fight natin against antimicrobial resistance. So dahil doon, dahil na-awardan siya, nag-join si Muy dun sa League of AMR Warriors with Captain Antibiotic. Then hindi lang si Captain Antibiotic yung bida, meron din tayong incredible antiparasite, antiviral ninja, and antifungal destroyer. So together, they will make the world safe from antimicrobial resistance. So at this juncture po, no, so reiterate that misuse and overuse of antibiotics puts us all at risk and everyone has a role to play. So yun nga po, what doesn't kill us make us stronger. And if you want to be, parang at this point, i-encourage natin yung students natin, do they want to be part of the League of AMR Warriors? So aside from knowing the problem, we also have to know ano yung mga pwede nating solusyon na gagawin. So how can they become part of the League of AMR Warriors? So they can become part of the League of AMR Warriors by practicing good habits to lessen the spread of infectious agents, and this include regular hand washing, so yung proper hygiene, vaccination. So tulad po ng in-explain ni Dr. Berba kanina, it's a very good intervention para ma-prevent yung infectious diseases, adopting a healthy lifestyle to boost the immune system, and then let's keep our environment clean para hindi mag-grow and mag-spread yung mga germs na ito. And then cooking food thoroughly because there are some types of germs na pwede pong mag-grow sa food, no, kapag hindi sila niluto ng tama. And of course, kinakain natin yung food. So that's one way na kung saan magkakaroon tayo ng infection. So hindi ko na po ito isa-isahin. I'm sure you are very well aware of all these practices. So kailangan lang po nating i-reiterate yan sa mga estudyante natin. And kung may chance man din po kayo, no, sa mga magulang nila, very important din po na matutunan nila yung tungkol dito. And then another way by which we can become part of the League of AMR Warriors is kapag may nafe-feel na sakit, laging kumonsulta sa doktor. No? So we have to consult a qualified healthcare professional early on. And then, of course, observe proper etiquette, especially when coughing. So cover your mouth when coughing or sneezing. And then kung may nararamdaman na po tayo na sakit, and I think na parang natuto rin po tayo, no, with this COVID-19 pandemic, yung pag-isolate or pagka-quarantine, na kapag may nararamdaman na tayo na sakit or symptoms, i-avoid na natin yung unnecessary contact with other people para hindi natin sila mahawakan or hindi natin matransmit yung sakit. And when sick, always make sure na hindi po nawawala yung panatilihing kumain ng nutritious food, drink lots of water, rest well. So very basic po lagi yung mga. So yan po, in-explain lang isa-isa. And then, responsible use naman ng antimicrobial. So how do we make sure? So of course po, kaya tayo kukonsulta sa doktor kasi kailangan natin ng prescription pag bibili tayo ng antibiotics. Sabi nga po ni Dr. Berba, di ba, yung meron na tayong policy ng no prescription, no dispensing policy. And then compliance. So kapag sinabi ng doktor na good for 7 days, iti-take po natin yung gamot as directed, no? As kung paano sinabi ni doktor. Tapos finish therapy, so ubusin natin kahit na we feel better on the 3rd day, 4th day, kung kailan mayan, kailangan tapusin yung gamutan and then inumin ng tama, no? Inumin po at the correct dose as prescribed by the physician. And don't share, never share. So very uso po sa atin, mga Pilipino, yung prescription sharing. So kunwari, hindi nila tinapos, nas may natira sila na antibiotic, tapos i-share sa iba, sasabihin na, nung nagkasakit yung anak ko, ganyan-ganyan din, yung naging sakit niya, tapos ito yung ginamit niya. So try mo ito, ibigay ito. So hindi, although of course po, may good intention po yun, no? Parang gusto mo lang din naman makatulong. Pero ang sasabihin po natin is, ipakonsulta na sa doktor. So yun po yung mas magandang tulong na mabibigay natin sa kapwa natin. Kasi yung mga ganito na i-share natin yung prescription or yung mga natirang gamot, they can lead to inappropriate treatments and they can just cause the development of AMR. So again, there is no time to wait. We have to secure our future from drug-resistant infections. So we call on everyone to be AMR champions. You po as teachers, as mentioned kanina po ni Doc, no, you have a very important role to play. So we ask you, we enjoin you to join our fight against antimicrobial resistance. Anyone can be a steward for the future. Ibig sabihin, magiging katiwala po tayo ng kinabukasan natin nun. Para in the future, kahit hindi man para sa atin, kundi para sa magiging anak natin o anak ng anak natin, may mga magagamit pa rin sila na effective na antibiotics. So for you po as teachers naman, take the pledge. So these 2 words for the future, by taking the pledge, I think ipapakita rin po ito mamaya. And that's all po for the presentation. Maraming salamat po for your kind attention. And if you have any further queries, you can email us po dun sa email address na nakalagay dito. Muli po, maraming salamat. And over to you, Miss Melaine.
All right. Thank you very much, Ma'am Mallari or Miss Doe, for that very interesting discussion on how our elementary learners can be taught about AMR. I particularly enjoy the storytelling part, and I'm sure that our teachers and our learners who are watching us in Zoom and also via Facebook Live have enjoyed that part and all the other parts of your discussion. So we have gained significant insights from the talk of Ma'am Mallari and Dr. Berba. And before we commence this insightful webinar, we will have a short question and answer portion where our esteemed resource speakers will answer queries from our live audience, both in Zoom and in Facebook Live. So we encourage our Zoom platform participants to type in their questions through the chat box, or you may also raise your virtual hand if you would like to unmute or to ask a question. Again, to our Zoom participants, you may type in your questions through the chat box or raise your virtual hand if you would like to unmute and raise a question. But for the meantime, we have some questions from our Facebook Live question or viewers rather. So I think this is addressed both to our resource persons. Hello po, Dr. Berba and Ms. Johanna. Very timely po ang inyong topic. As an elementary teacher po, madalas naming makausap ang mga magulang ng mga bata and nakaka-encounter po kami ng mga parents na hindi nagkaroon ng pagkakataong makapag-aral kung kaya prone talaga sila sa misinformation and maling paggamit ng antibiotics. Tulad na lang po ng pag-inom ng amoxicillin sa lahat ng klase ng sakit. Kahit sakit ng ulo o katawan o ng puson ay iniinuman ng amoxicillin. Kaya madalas ay may conflict sa kung anong sinasabi ng guro sa sinasabi ng magulang. Madalas po kasi ang nangyayari, sabi po ni mami o sabi po ni nanay o tatay ay pwede ang amoxicillin sa ganitong sakit. Ngunit pinapaalalahanan namin ng mga bata na hindi po iyon tama. Paano namin sasabihin sa mga bata na ang nalalaman ng kanilang mga magulang ay hindi po tama o kailangan pong i-correct? Paano namin po ito i-address?
Yan. Siguro, ako na muna sasagot.
Go ahead po.
Ako siguro I will, kung masyadong madalas kasi mangyari, maybe pwedeng i-call yung attention ng parent para hindi masyadong, kasi syempre nakakalito rin yun para sa bata, 'di ba? Kung sasabihin mo, mali yung sinasabi ng mama mo or ng papa mo or ng tatay at nanay mo. So, I think it's best kung pwede i-text or tawagan or try to send a letter explaining your side and the new concepts of AMR. Hindi naman kailangan masyadong mahabang-mahaba yun or pwede mag-usap yun. Para hindi natin ilagay yung bata sa gitna nung magkaiba nating knowledge at saka kung ano yung gusto nating mangyari. So I would perhaps do it that way. Minsan po pwede rin magpa-Zoom yung teacher, di ba? Zoom meeting with several parents. We're doing this now. Our school is starting to teach about AMR. Tapos ituro na rin sa kanila para meron rin silang pagkakataon na mag-learn ng new concepts.
Thank you po, Dr. Berba. That's a very concise and comprehensive answer. Then ito po, may another question po from our participant here in Zoom. Good PM po, hindi po ba nakakasama yung pag-take ng antibiotic lalo na kung meron pong kidney disease? Salamat po.
Sige, though ako sasagot muna ha. So kung kailangan talaga ng mga antibiotic kahit na may kidney problem, pwede naman po ibigay. Tapos may tinatawag kaming adjustment eh. So, usually binabawasan namin yung dose para tama. It will conform with the needs of the body. Minsan kasi iba na yung pangangailangan ng katawan ng isang tao kung meron siyang chronic kidney disease. So, ina-adjust po. Yeah.
Okay po. Thank you po, Dr. Berba, for the answer. This one po naman, I think si Ma'am Do. Ang ganda po ng pinakitang sample ng storytelling. Baka po pwedeng makahingi po or ma-download po namin from a website yung story para ma-present po namin sa aming mga learners.
Maraming salamat po sa pag-appreciate ng material. So actually po, no, this is something that we are trying to coordinate also with the Department of Education. We will continuously coordinate with them po on how we can incorporate itong mga AMR concepts sa basic education natin. So we will share the materials with the DepEd through the BLD, the Bureau of Learning Delivery. And then kapag i-accept po ni DepEd yung mga materials, so dun po natin siya i-share, i-disseminate sa lahat ng mga guro. So this will undergo consultation pa po, no, with our DepEd para ma-make sure po na align tayo dun sa mga competencies na gusto rin na i-emphasize ni DepEd and yung mga materials na available sa atin. So rest assured po na kapag ma-finalize na natin and makausap na natin yung DepEd kung paano talaga siya i-integrate dun sa curriculum, these materials will be shared with you po. Salamat po!
Thank you very much po, Ma'am Do. So sa ating pong mga teachers na nanonood ngayon, kindly wait lang po, siguro i-upload po yung ating mga materials, not only yung pinakita po ni Ma'am Do, kundi yung iba pong materials pa about AMR sa either ating LMDS, yung ating pong portal kung saan makikita yung ating mga learning materials. And I think this will be the last question po. Good afternoon, Dr. Berba and Ma'am Mallari. Thank you so much for the very informative discussions. My question is, are vaccines one way to prevent AMR? Because maybe I could use that to encourage my students to not fear vaccines, especially that they are already being rolled out for vaccinations for COVID-19.
Sasagutin ko yung part ko. So, ang concept kasi doon ay kung magpapabakuna, nare-reduce natin yung risk na magkasakit tayo. At kung bababa yung pagkakataon na magkakasakit tayo, most likely mas bababa rin yung pangangailangan para uminom ng antibiotic. So, yun po yung parang track. Kaya, isa talaga sa mga strategies yung vaccination to fight AMR. Yes.
Thank you po. Ms. Do.
Thank you, Doc Berba. Just to add po, so tulad nga po ng napaliwanag, no, lagi po, hindi pa rin po naluluma yung kasabihang prevention is better than cure. So bago pa man magka-infection, kailangan iwasan na natin. Kaya nga po, dun po pumapasok yung importansya ng mga bakuna. So yung bakuna po kasi is one way to prevent yung mga vaccine preventable infections. So, important po talaga sila. Pero hindi naman po sinasabi na kapag nagpabakuna, hindi na may iwasan na magkaroon ng ibang klaseng infection. So, basta po may naramdaman, lagi pong kumonsultat sa doktor kung ano yung naayon na gamutan para sa inyo. So, pero tama po yun, i-emphasize po natin na very important po talaga yung pagpapabakuna as a way to prevent infections. Thank you very much po.
Apo. Thank you very much po, Dr. Berba and Ma'am Do, for the very informative answers and concise answers. And I think that ends our Q&A session. Kasi most of the questions po, yun lang din po yung iniikutan nung tanong. So thank you again po to our esteemed resource persons for letting us learn from you this afternoon. But of course, before we end this session, as mentioned a while ago by Ma'am Mallari, we will be inviting everyone to take your pledge as stewards for the future by going to the link flashed on your screen or by scanning the QR code. And all together, let us take the pledge by watching this video.
Hello, my name is Dr. Takeshi Kasai. I'm the World Health Organization Regional Director for the Western Pacific. It is World Antimicrobial Awareness Week, and I want to talk to you about why we need to work together to tackle antimicrobial resistance. When we overuse and misuse antibiotics, antiviral, antifungal, and antiparasitic medicines, infection become harder and sometimes impossible to treat. This is a very serious threat to all of us. If we allow antimicrobial resistance to keep growing, minor injuries and simple surgeries could become very dangerous. Thank you for your solidarity and support. It's helping to make the Western Pacific safe and healthy for the 1.9 billion of us who call this region home and for generations to come. Thank you very much.
So there you have it, ladies and gentlemen, the conclusion of the first part of our two-part webinar. We will be seeing you again tomorrow, but tomorrow we will be focusing on how to teach AMR concepts and awareness in our secondary classrooms or for our high school learners. So to our viewers, if you are going to share your thoughts, takeaways, or selfies relative to today's part or to today's webinar, we highly encourage you to include our official hashtags in your post, and you can see these hashtags in your screen. We would be more than happy to see your posts on the different virtual platforms. Just a gentle reminder for everyone, kindly fill out the evaluation form using the link or the QR code shown on the screen. The form will contain content evaluation questions about today's episode, and you need to get at least 60% correct answers for you to receive a certificate of participation. We will be releasing certificates to eligible participants within this week. Thank you once again for joining us this afternoon. Thank you to our esteemed resource persons, Ma'am Mallari and Dr. Berba. And please stay safe and healthy. God bless us all.